Now let us move on to our second subtopic. We will be discussing on the etiologies of each types of diabetes, followed by their pathogenesis in subtopic 3. For this topic, you will learn about the etiologies of type 1 diabetes mellitus, type 2 diabetes mellitus, gestational diabetes mellitus, and other types of diabetes. Type 1 diabetes occurs when your immune system attacks and destroys the insulin-producing beta cells of the pancreas. Studies reveal that type 1 diabetes is caused by the combination of genes and environmental factors. Environmental factors such as viruses might trigger the disease. Hence, beta cell destruction will lead to absolute insulin deficiency in type 1 diabetes. Type 2 diabetes occurs in a combination of insulin resistance and beta cell dysfunction. It is caused by a combination of peripheral resistance to insulin action and inadequate secretory response by the pancreatic beta cells, or known as relative insulin deficiency. Type 2 diabetes is the most common type of diabetes mellitus. Approximately 90% to 95% of diabetic patients have type 2 diabetes, and many of them are overweight. Gestational diabetes mellitus, GDM, is a condition of glucose intolerance with the onset or first recognition in pregnancy that is not clearly overt diabetes. In pregnancy, increased secretion of placental hormones leads to increasing insulin resistance, especially throughout the third trimester. GDM occurs when beta cell function is insufficient to overcome this insulin resistance. Other types of diabetes were as follow. Number 1. Monogenic diabetes syndromes. Number 2. It may also occur in diseases of the exocrine pancreas. For example, cystic fibrosis and pancreatitis. Apart from that, prolonged consumption of glucocorticoids and thiazides may result in drug-induced diabetes. In patients with endocrinopathies, diabetes may develop as a consequence of these conditions. For example, acromegaly, Cushing syndrome, pheochromocytoma, and hypothyroidism. Thank you for listening to our presentation. See you in the next subtopic.